So, you're helping a loved one get ready for cataract surgery. You know that feeling, right? It's this weird mix of being really hopeful, but also pretty anxious. Well, let's talk about how we can take all that stress and turn it into a calm, confident plan.
Does this hit a little too close to home? Yeah? You type cataract surgery risks into that search bar and bam, suddenly you're convinced every single rare, terrifying complication is waiting right around the corner. We've all been there, and that impulse is exactly why we need to talk.
And that's the big question, isn't it? Our whole goal here is to give you the tools to flip that switch. We're going to move you from that late-night panic mode into a state of focused control, and we're going to do it with a clear, step-by-step approach. Okay, first things first, let's tackle this late-night Google problem head-on. The reason it sends us spiraling is because it totally misses the bigger picture. We have to reframe what this surgery is really all about. You know, it's not just about swapping out a cloudy lens. For a senior, this is so much more.
Think about it like this. It all starts with blurry vision, but that can quickly lead to someone being afraid to take the stairs, or drive at night, or even just meet up with friends. And that slowly chips away at their independence. So the key thing to remember is this surgery isn't just about sight. It's a direct investment in their safety, their confidence, and their quality of life.
All right, let's talk about that big, scary word, complications. The internet treats it like this one giant, terrifying blob. But in reality, there's a huge difference between a true emergency and just a manageable little bump in the road.
Okay, this right here, this slide shows you the disconnect perfectly. On the left, you've got the super rare, scary stuff that Google just loves to wave in your face. But look at the right. That's what's actually way more likely. Temporary things, like a little dry eye or some inflammation. Stuff the medical team is completely prepared to handle with simple things like eye drops. The goal isn't to pretend risk doesn't exist, it's to understand it accurately.
I love this quote from our source because it nails a huge, and I mean huge, issue that people don't talk about enough. Dry eye. After surgery, the surface of the eye can get really irritated, and that makes your vision fluctuate. It can absolutely feel like something is seriously wrong with the new lens, but a lot of the time it's just the eye needing a little extra help, like some artificial tears while it heals.
And here's another big fear. What if the vision gets foggy again a few months from now? Well, that's often because of something called posterior capsule opacification, or PCO. The most important thing to know is that this is not the cataract coming back. It's a common, predictable thing that's fixed with a super quick, painless laser procedure right there in the doctor's office. Think of it more like a tune-up, not a failed surgery.
Okay, so we've put some of those big fears into perspective. Now, let's switch gears and get proactive. Let's talk about making smart decisions before the surgery even happens.
This little story from a waiting room, this gets right to the absolute heart of it. The most important question isn't, what's the best lens out there? It's, what's the best lens for my loved one's actual life? Success is personal. Is their number one priority reading a book up close, seeing a golf ball way down the fairway, or is it driving comfortably at night? Defining that specific goal is job number one.
And that decision often boils down to a trade-off, which you can see right here. Standard lenses, the ones usually covered by insurance, are fantastic at giving you crystal clear vision at one distance, either near or far. Premium lenses, on the other hand, they try to do it all, to reduce the need for glasses. But that complex tech can come with its own set of trade-offs, like maybe seeing some halos or glare. Plus, there's a big out-of-pocket cost. There's no single right answer here. There's only what's right for their lifestyle and their budget.
You know, choosing a surgeon isn't just about their reputation. It's about their system. And these 3 questions, they help you see that system in action. They're like a little stress test for the clinic's emergency plans and their real-world experience. A good team is going to have clear, confident answers, because this isn't their first rodeo.
Think of this as your final pre-flight check. Just ticking off these simple boxes means no last-minute scrambling. Having that full medication list ready, understanding the drop schedule ahead of time, getting the ride locked in, and knowing exactly who to call, this little bit of organization prevents a whole world of stress on the day of the surgery.
All right, surgery is done. Now what? The focus shifts to recovery. And trust me, a little bit of planning here goes a long, long way in keeping everybody calm and on the right track.
This timeline is so important for managing expectations, because healing is not a straight line. It just isn't. The eye is adjusting, swelling is going down, so vision can be blurry one minute and clearer the next, especially in that first week. Just knowing that these ups and downs are a totally normal part of the process can stop so much of that, is this okay, is this right, anxiety. Seriously,
Forget all the complicated apps and gadgets. Sometimes the simplest system is the best one. Print out the schedule, tape it to the fridge where everyone can see it, and then set recurring alarms on a phone. Done. This just cuts down on the mental load for everyone and makes it way less likely you'll miss one of those super important medication drops.
If you remember just one thing from this section, please make it this slide. This is your post-op cheat sheet. It's your peace of mind. It boils everything down into 3 clear lanes. When to just relax and stick with the plan, when to make a routine call, and when to pick up the phone right now. Having this framework ready to go makes a huge, huge difference.
Okay, let's bring this all home. We've really gone on a journey here, from understanding what's really at stake with this surgery, to managing our expectations about complications, and finally to having a clear playbook for what happens after.
And this right here, this is the most important takeaway. You don't need to become a medical expert. Your real value is being the organizer, the question asker, the scheduler, the calm presence in the room. You're the project manager for a successful recovery.
And this just sums up everything perfectly. You can't eliminate all risk, it's impossible. The goal is to make risk boring. By understanding what's common, by asking the right questions, by having a clear plan, you strip the emotional power away from the unknown. You turn potential problems into manageable, predictable, and frankly kind of boring next steps. And that, right there, is how you get from fear to focus.